For a lot of you who come in today, you're used to very out of the world things, path-breaking things, out of the turn things that people have done. But sometimes it is very important to understand simple things in life. In our race to achieve the best in the world, we somewhere lose the connect with some very, very basic and important things in life. And you never know that just momentary thing about right thing at the right time, by the right person in the right manner, makes the world of difference. This is what I'm going to attempt to do in the next 45 minutes or so with you. There is a lot that we need to cover, so I'm going to make it very simple. I promise few important things to all of you. I am a doctor, but probably not more than 3 times I will use a medical term when I am talking to all of you. It's all going to be simple, which everybody would want to understand. So before I get on, let me understand how many of you are doctors in this audience. 1, 2. Okay. So I've got to be careful of them. Okay. And rest of you are from diverse fields. So that makes my job easy because my talk is aimed at a common man. It's not aimed towards physicians or practitioners. But it's actually good for them also because India is the only country where you can become a doctor without having undergone a proper CPR certification ever in your career. India is the only country where you can give birth to a child, and when the child chokes on a groundnut, you can blame the child but not the mother for having not ever trained in how to handle the child or that emergency situation. So on that note, I will begin by acknowledging Manthan for giving me this opportunity, and here is what I want to do at the end of the day. At the end of the day, we should be able to understand what is a major medical emergency, understand what's a minor medical emergency. We are living in a dangerous world, and this city itself has seen some very, very challenging. This city has witnessed a couple of terrorist attacks and multi-casualty incidents, and I thought that as a layperson, there is something very important that you and me can do rather than being bystanders. And I thought I'll address that part of the story on what to do as a bystander in case of a multi-casualty incident. The way we'll do is it's going to be very interactive, but we'll take the questions towards the end. I know Manthan is very well known for question and answer sessions towards the end, and I am hopeful that I will be able to address this. So let me ask you a few questions. How many of you have had a medical emergency to face ever in your life? Put your hand up, those who have faced. Okay, so about 15 to 20%. How many of you have had seen somebody die in front of you? Good. How many of you have lost someone in front of you and felt, I wish I could have done something? So you are a very fortunate audience that there are very few people sitting in the audience who can say this. But if this question is asked to a larger audience, you will hear horror stories. Horror stories. You can't sleep if you listen to stories like that. There is a child who is choked right in front of the mother, and the only treatment the child gets is a sip of water. Nothing else. And this is ignorance. Ignorance to its best and its worst. This is what is our aim, and we need to change that. Right? Let's look at what happens commonly in case of an emergency. Have you seen an emergency situation? A very common emergency situation? Heart attack. Okay, more commoner than that. Let's see. Let's see, a very common emergency. What's wrong? What's wrong with him? What's wrong with him? Man, what's happening? What do you want to do, sir? What do you want to do on him? So just look around and what happens in an emergency. This is exactly what the world happens, right? There's a guy who is throwing a fit. There's a person who's watching next to him. Next people are there watching, standing up from there what is happening. And somebody is telling the next person, I think we should do this. All right? So if you look at a situation like this, a scenario like this, this is what happens routinely. The first thing is we press a panic button most of the times in a medical emergency situation. Panic is the last thing that needs to happen in any emergency situation, least of all a medical emergency. The second one, which is abundance in this country, is called as expert commentators. They sit in the commentary box and give the world of commentary, but they have never probably played 5 overs on the pitch. These are the people, in case of an accident, if you look at this, he is watching what tire is this made up of. Is it JK tire or Apollo tire? And they will be discussing, I think he must be speeding, he must be doing that. All kinds of discussion happen, right? Then this is another species. This is called as a mute spectator. We become just mute spectators to horror stories. Have you seen the visuals of the police inspector who was hacked near Chennai and he was lying on the highway for 45 minutes? Did you see the visuals of the Jaipur accident into a tunnel where a family of husband, wife, daughter and son were entering to the tunnel, hit by a bus, lying down on the road, mother died on the scene, the other child also died on the scene. 35 vehicles crossed that scene and nobody stopped. That's a shame. We can't say that we have arrived in this world if we don't care for our fellow human beings. And least of all is see, look, a crying husband who has a dead body of his wife next to him and another child who is crying on his shoulders and 35 cars pass by. This is utter insensitivity towards a human being. Today it is them, tomorrow it could be you. And there are enough stories of people who have lost their lives because of road accidents because nobody stopped their cars for about 45 minutes and they bled about 3 liters of blood. No Dr. Joshi can save you if you don't reach in time. We are a very, very lovely country. We invoke blessings of Almighty in every situation. And the one situation where God is always there on the front page is a medical emergency. Somebody is having chest pain and the relative gets into the puja room praying for Mahamrutyunjay Path. That's no treatment for anybody. Right? Last of all, do you know what this visual is about? The only first aid in 99% of emergencies in India that is done is a glass of water. You have a heart attack, pani pile beta. Accident ho gaya, pani lao beta. Aap mar rahe ho, lemon juice pila de beta. This is utter ignorance, and that's what we want to change tonight and understand what we need to do. So what's an emergency? I think Chandana addressed this in her opening talk. What is an emergency, if I may ask you? It's not about medical emergency. Somebody wants to tell me what's an emergency? Not 1971. Okay. What's an emergency? Just simple. What do you think is an emergency situation in life? Sorry? Situation which is not in our control. Okay. All right. Unexpected, not in our control, and which needs immediate attention. Yes, sir.
Yeah, actually, it's something like immediate aid or something ABC, as you can call it, airway breathing and circulation.
You must have undergone a first aid training, man.
I'm a doctor, basically.
It's a problem with doctors. All right. All right. So let's understand what's an emergency. Simply put, it's a situation which we are not prepared for. All right. It's as simple a definition that gets for. And as far as health is concerned, this is a situation we are always prepared for our neighbors, for others, but we never think it is going to happen to me or my family. Right? So, before we get on, how do you prepare yourself for a medical emergency? A broad-based thing. These are my 5 tips that I want to give to all of you in today's time. The first and foremost in today's time, the biggest first aid that you can do for yourself is to have a good health insurance cover. There is a disclaimer. I am not representing any health insurance company tonight. All right? If you look at the equity market returns versus the year-on-year rise in premium of healthcare insurance, probably you could have got better return by buying the policy 3 years ago, because it's rising about 15 to 20% annually the health insurance premiums. No market has given you that return in the last 3 years, right? So health insurance is extremely important. For those of you who have a company health insurance, don't just bank on it, because that may be inadequate in today's time. Any idea how much does it take to treat a heart attack in today's time in the best possible manner? At a reasonably good hospital, not the top end hospital, a heart attack which requires angiography and angioplasty, how much is the cost of treatment? So the thousands figures have changed to lakhs, right? So you really need a good cover. The second thing that you want handy is you need to have an ambulance access number available with you. What's the number you dial in case of a medical emergency? 108, right? It's good to know that number, but it's also good to know if there is a hospital nearby, the number of that hospital. Because if you stay in old city and it is congested and the ambulance from 108 is going to take time, it's very important to know the nearest hospital ambulance number for you, all right? The next one is good to have hospital number. And the last two important things, first aid training and first aid kit. Very, very important. And you will sometimes wonder how ignorant or how foolish people get by not having undergone this training or not having got the right kind of things. People go on treks, people go on wilderness trips, and they don't carry simple first aid things with them, and people die of snake bite because they did not carry the right kind of thing with them. They had the world's best protective equipment with them, but they did not carry anti-snake venom, which should be there if you are going to forest. So let's look at major medical emergencies. I'm sure most of you have heard of these terms: heart attack, stroke, unconsciousness, accident, cardiac arrest, choking, seizures or fits or convulsions, and then burns. So although there is a wide spectrum of condition, I thought let's focus at some of the most important things, and we'll go and address each of these. The problem is, patient doesn't come and tell you that I am having a heart attack. Patient doesn't come and tell you that I am having a cardiac arrest. For a lay person, you have to identify, does he have this problem? So let's look at how do you approach a patient who's likely to have a medical problem. So a simple way of looking at it, if there is a person or a patient or a victim who is unwell, the first step that you want to go across and check whether he's conscious or unconscious by tapping and asking, are you okay, are you okay? If the person is conscious, 50% of the life-threatening problem is already taken care of. You don't really need to worry so much as in an unconscious patient. And then if he is conscious, there are 4 things that I want you to ask anyone. The first one is, do you have chest pain? The second complaint is, do you have breathing difficulty? The third thing is, do you have weakness on any side of the body? And the fourth and the most important thing is, ask the person, how are you feeling? Don't make your judgment if the person is fine or not. Many of the people have made this error, and it has resulted in huge losses to those families in terms of either death or a severe disability because of not anticipating or not identifying things at the right time. So let's quickly look at an unconscious person. What are we going to do in case of an unconscious person? And this is extremely important. You'll find this very commonly because of low sugars, because of paralysis, because of low blood pressure. Multiple things can cause this. The first thing that you want to do is assess for responsiveness. Are you okay? Are you okay? If the person is not responding, the second thing that must come to your mind is call for help. Now this is the most beautiful thing that I ever hear every single day. अरे डॉक्टर साहब बंजारा हिल्स रोड नंबर 12 पे वो एक्सीडेंट हो गया, जल्दी से आ जाइए. किधर से आऊं भैया बंजारा हिल्स रोड नंबर 12 पे? It is such a big road. Where on road 12 Banjara Hills? If I have to search that place for 15 minutes, all the effort of putting that ambulance is gone. So you need to have a structured way of calling for help. You must know how to call for help in case of an unresponsive patient. It's extremely important to call for help early. Don't wait for 15-20 minutes and then call for help. You would have lost half an hour. The next thing we want to do is, after we have called for help, are you okay, are you okay? Let's call for help, and then once we've called for help, we want to look for whether the person has pulse or not. And for God's sake, there are few times when I would want all of you to forget Bollywood films. Right? You've seen the Bollywood film scenarios, right? Where is the pulse checked? In all the places where they should not be checked. Right? So don't check the pulse on the hand. You want to take your two fingers like this. All of you, please put your hands up like this. Go to the center of the neck. You feel a bony prominence. Just move your finger to the right and press it into the groove. Do you feel something? I told you we'll show you some magic tonight. Okay. Do you feel the pulse? Those who don't feel, you have a serious problem. Okay. You feel the pulse? All right. So that's the pulse because it is closest to the heart. You want to feel that pulse instead of this pulse, and then take out your cap and say, I am sorry. Right? You don't want to do that. You want to check the carotid pulse. If the person doesn't have pulse, this is the time to begin what is called as CPR. And we'll quickly look at the demo of how to do CPR. Can I have Dr. Shabaz and Sudhakar? Can I have somebody to come in here to help out? Now before we go there, let me give you a good way of calling for help. It's called a methane message. Methane, my call sign is for M, E is for exact location, T is for type of incident, H is for hazards at the site, A is for access, N is for number of victims, and E is for what kind of emergency services we need. So let's look at this. Young kid had a seizure right now. So instead of calling, hello, ab bolo, aur sahab kuch ho gaya bhaiya, unko bhejte kya jara? कुछ हो गया भेजते क्या जरा, क्या चाहिए भाई, आलू वड़ा, idli, dosa, क्या चाहिए? Right? There is a structured way in which we want to call for help, and trust me, we lose vital minutes in this kind of conversation. My name is Dr. Joshi. I am calling from Vidyaranya School campus, which is opposite Secretariat, next gate after Hotel Anmol. Right? There is a young man who has had generalized fits, is what I think he has at the current time. He's just stopped from his fits, but he's unconscious at the current time. The access is from the main road just after the Anmol Hotel. The number of casualties is 1 person, and the emergency service I need is an ambulance which can take care of an adult person. May I know who's speaking? That's the way you give a structured message. And this is a system that you must follow in any emergency. Whether there is a fire at your factory. My name is Dr. Joshi, exact location is Balanagar, type of incidents is fire, hazards are, there could be explosion, access is from Kukatpalli side, number of victims involved probably are 15, and what services you need. I definitely need fire, I might need ambulance, and because of security issues, I want the police backup also to be there. That's the way you call for help, right? Don't say, kuch ho gaya sahab, kuch bhejte kya, right? Right. So let's look at, what's your name?
Kushal.
Come Kushal, come here, stand here. Okay, can you check for responsiveness on him? So let's look at responsiveness. Are you okay? Are you okay?
Are you okay? Are you okay?
No response. What would you do next?
I will check his pulse.
No, you'll call for help. You agree? Yes, so we'll give the methane message, the ambulance is on the way. All right, let's do next thing. What's the next thing?
Check his pulse.
Check. There is no pulse. What are you going to do now? Again, forget Hindi films, okay? They do all kinds of naughty things. Okay, it's not needed. What as a lay person we need to understand is, now the emphasis from the kiss of life is gone. The emphasis is only on chest compression. If you can't do anything, just do good, simple chest compressions, and you might save somebody's life. And I'm going to share a couple of success stories as we go through this. Let's begin the CPR with the heel of the hand on the chest bone, which is called as the sternum, on the lower half. Another hand, lock it properly, just follow it. All right, keep your arms straight, and there we go. 1 and 2 and 3 and 4 and 5, 6, 7, at the rate of 100 times a minute. What is important is, you want to save the life or you want to be worried about broken ribs? So press it as hard as possible. Don't worry, yaar, haddi toot gayi to kya karunga. I always tell this to my residents, it is good to be alive with broken ribs rather than be having fixed and dilated pupils. Right? So it's very important that we do this part. As a lay person, this is the only thing that I want all of you to remember. Forget about mouth-to-mouth breathing. Good, continuous chest compressions. And if you get tired, ask somebody else to take over from you. This is the single most intervention which is cheapest and has shown maximum results in saving lives in case of cardiac arrest. Do we all get this clear? Yes, no? Yes. So, assess responsiveness, call for help, begin CPR at the rate of 100. Can we do it one more time?
1, 2, 3, 4, 5, 6.
Fantastic. Can you give a big round, all of you? Thank you. Come. Now, there is a device called as automated external defibrillator which has now been created. You must have seen Amitabh Bachchan being shocked in some of the movies, right? Which was that movie? And then recently, Jab Tak Hai Jaan, right? I don't know how many times he was shocked in that movie. He was, right? 3 times, 2 times. आप सोच के बताना मुझे. So this is one machine which you will now see. It's being deployed at locations where there is high intensity pressures, airports, casinos, football stadiums, hopefully at IPL stadiums. This is high stakes, right? IPL games has high stakes, no? It should be more towards the owners club, right? Not in the stadium, I agree, Ravi. That must be the lawyer. All right, so you have the AED. This is one device that we want to know about. Quickly, I'm going to talk about this. You'll see this at airport. This is a machine which is created for layperson. All you need to do is just put the button on and it starts talking to you. Does it talk right now? Can you put it on? So that's the machine. Let's put it on. Hello?
Apply pads to patient's bare chest.
So it talks you
Plug
through.
in pads connector next to flashing light.
So it was created basically for a layperson. You just put on, it tells you what to do, where to place the pads, where to connect it, and it analyzes the heart rhythm. If there's a need, it will tell you to shock. All right? So it's very good to understand this, but we are running short of time, so I'm going to quickly get on to the next part of the story. Shocking is very important to get the heart back to normal rhythm. Let's look at the next part of the story. We've just finished CPR. The most important message that I want to give all of you is, forget anything else. If the person does not have pulse, please begin CPR and continue it till the time some experienced provider takes over from you. You will never be able to make out that. As a lay person, just continue the CPR at least for 2 minutes continuously. If you have this machine, put the pads on. If the machine feels that there is no need to shock, it will tell you, stop, restart CPR. It will tell you that. Okay? Great. So we talked about cardiac arrest. Cardiac arrest means a person who is unresponsive, who is not breathing, and who does not have pulse. All three are. Sorry? Mouth to mouth breathing, yes, it requires a little bit of training, but the latest guidelines tell you that as a lay person, if you don't know mouth to mouth breathing, don't worry about it. Because what happens as a single person to do chest compression and mouth to mouth breathing, lot of times the chest compression gets compromised. So it's good to continue good chest compressions on the patient.
That is only for Bollywood.
What? Mouth to mouth? I agree with you. And he says mouth to mouth depends upon who's the victim. So next one is chest pain. One complaint which is killing lakhs of people in this country every single day. Any idea how many people die out of heart attack every single day in this country?
Maybe a lakh.
Every single day, how many people die out of heart attack? Take a rough guess.
10,000.
3 out of 4 people. This must be a statistician or a mathematician. Right? 10,000. 1, 10,002, 10,003. Any more guesses? Okay, about 3,000 people every single day. This is the official figure. I'm sure the unofficial figure will be much higher. Sorry, ma'am? 3,000 per day.
In India?
It's the death, not the people who are having heart attack. People who die because of heart attacks every single day is 3,000. Those who have heart attacks is twofold of that. Okay? It's a shocking number. If I ask how many of you know somebody who has had a heart attack, put your hands up. It speaks for itself, right? This is a site you should never ever sit on. If somebody holds his chest tight and tells that he has burning sensation or tightness in the chest, think of it as a heart attack. Don't follow the conventional dictum of salt, right? Gelusil, then ranitidine, then Omaze, and by the time you reach hospital, it is no more. Every week I hear such stories. I'm going to share with you one story of a bank employee who was brought to us in a cardiac arrest. And I was walking through this emergency room after a couple of hours of this incident happened, and I saw somebody who was crying behind the curtains, and I asked, what has happened? They said that there was a young guy who was brought dead. And I could hear this lady saying, all night I was applying balm on your chest, I wish I had got you to the hospital. There are plenty of stories, but for want of time I can't share all of them. Let's understand what's a heart attack. It's basically a simple analogy of a blocked pipeline, just like what you have at your homes. If there is a clog which comes into it, your pipelines get blocked, and then the distal part doesn't get the flow, and that's how the heart gets affected. So if a person has a heart attack, we've understood what it is, we've understood how to identify it. Now people ask, left side में pain हुआ तो heart attack होता है क्या, right में हुआ तो नहीं होता है? Just forget all this. Any chest pain from today, just tell yourself, I want to rule out heart attack. Don't take chances with this symptom. This is a killer symptom. You should never take a chance with this symptom. Who is at risk? Tell me, who are the people who are at risk for a heart attack? Elderly. Just day before yesterday, there was a 27-year fellow who underwent 3 stents in his heart. Day before yesterday story I'm talking about. And everything. Stress. So there are multiple factors. Stress, obesity, bad diet, cholesterol, smoking, diabetes, hypertension, on and on. But according to me, there is only one problem. If you have a heart, you are likely to have heart attack. The problem is when it will happen. You can only delay that process. If you have a heart, you are likely to have heart attacks. So don't take chance with this as a symptom. Yes, people who smoke and people who have diabetes, these are two who are at highest risk of having heart attack. And diabetes per se very important because they might not get the pain because their nerves get blunted because of the high sugars. So you've got to be careful about that. What to do if the person has heart attack? What would you do if somebody holds his chest like this, and you've seen the dramatic scenes in Kabhi Saas Bhi Kabhi Bahuti, right? Nikhal ja mere ghar se. Tumne mere ghar ka naam mitti mein mila. Then the father is sweating, and then he falls down, and there is a bottle lying there, right? As he tries to reach the bottle, falls, and then he's no more, right? You've seen such scenes, no? What do you do in such situation? What do you do? What should you do? Cough? Okay, the first and most important thing that you want to do is, the heart is already strained, you don't want to strain it further. I lost my uncle who refused to come down 2 flights of stairs by people lifting him. He was a man of his principles. He said, how can anybody lift me? I am hale and hearty. Walked down 2 flights of stairs, reached the nursing home and collapsed right there. The first thing that you want to do is, do not make the person exert in any which manner. Okay? That's the most important thing. Second thing, don't crowd around the person because oxygen is important for that. For any emergency, crowding is not a good thing, particularly for heart attack. You want to give fresh air as much as possible. Okay? And then, if you think that this could be heart attack, please call for ambulance immediately. Because it just takes a fraction of a second for a heart which is contracting like this to become like this, and the person becomes unconscious right in front of you. So it's very, very important to identify it quick, call for help, and in the meantime, while the ambulance is coming, you give something. What is this tablet that you can give to the person? Sorbitrate? No. The tablet that you want to keep with you, all of us must keep this tablet with us, is called as Sprain. It's the soluble form of aspirin. Don't use any other form like Ecosprin or baby aspirin or all these things. You want soluble aspirin which can dissolve faster so that it can act faster inside. So soluble form of aspirin is the best drug, much better than sorbitrate to be given in cases of heart attack. Sometimes just a tablet of aspirin could open up the blocked artery. So give aspirin. If the patient is a known heart patient and he's keeping sorbitrate with him, that's the person where you can keep the tablet of sorbitrate under his tongue. But don't keep on repeating tablets of sorbitrate, they drop the blood pressure significantly. What is important is what not to do. I've already told you not to exert, don't crowd, and don't be there in front of, I think you are having a heart attack. This was little bit and now it has become so big. Right? And I've seen this happening in hospitals. The patient comes with probably heart attack and the young doctors, "Oh, sister, this is a heart attack. Oh, call this, don't call this." Arey bhaiya, mat. Shanti rakho thoda sa. Don't panic. You've got to relax, make the person comfortable. And if you ever want to feel what is called as the grip of trust, hold the hand of a person who's having heart attack. He'll never let go of that hand. You can see the death staring into the eyes of that person if he's really having heart attack. Right? That touch can reduce the heart rate from 110 to 90 if you just comfort that person. It works better than most of the medicines. It's important for all of you to remember. Next complaint which I want all of you to be careful about is breathing difficulty. Heart attack can present as breathing difficulty. Clots in the lungs can present as breathing difficulty. This is much more sinister than chest pain. Pain always seeks attention. Breathing difficulty, we think it's psychological. I will walk outside, I'll breathe fresh air, I'll take Nilgiri ka tel and I'll feel better. Alright? You don't need to think of all these things. This is a sinister complaint. Ask, is the patient asthmatic? If the person is asthmatic, the first thing quickly that you can do is get fresh air, and secondly, if he is having a pump, spray or an inhaler at home, most of the places at home now, most of the asthmatics keep an inhaler at home or a nebulizer, start that quickly. As I told you, it could be heart attack, don't sit on it, call for help immediately. This is one complaint you should never neglect. Chest pain and breathing difficulty, two complaints, never take chances with. Always go to the hospital, insist on the ECG being done, and if it is normal, then only you come out. There are doctors who might say, I don't think there is need for ECG. But I can tell you, 200 rupees for that ECG is a small price to pay against what you can lose with both of these complaints. Right? Call for help. Let's look at the third and very important thing. It's called stroke. Paralysis. Anybody has a family member who has paralysis? Put your hands up. Anybody who has a relative because of stroke who is bedridden? Put your hand up. Okay. Stroke, one is, it doesn't kill people. It disables them. And it just doesn't disable the patient, but it disables the family. Many of us are probably fortunate to be financially good and to be able to take care of people in the right possible manner. But to take care of a bedridden patient with an attendant around it, it costs you minimum 8,000 rupees a day if you look at hospitalization charges and etc. So this is one thing that you really don't want to sit, because in today's time there is treatment for it. What is paralysis? What is stroke? Exactly like heart attack, when the blood supply to the heart stops, you get heart attack. In the same way, the blood supply to the brain stops, you get what is called as brain attack or stroke. But one more thing that can happen is sometimes the pipeline can burst. That is called as brain hemorrhage. There are two ways in which you can get stroke. But if it is because of the blockage, then in that case, you have treatment in today's time. And that is what we need to remember. Now, how do you know that somebody is having a stroke? Simple three things. I want all of you to look at me and look at what's the first thing. Look at the face of the person. Ask the person to show his teeth. Can you show me your teeth, all of you? Let me check if you guys have paralysis or not. Show me your teeth. Smile. Okay. Show your teeth. You will find that the face deviates onto one side. This is a sign of stroke. Ask the person to extend the arms and close the eyes. If you find that one of the sides is swaying by, there is a weakness on one side. All right? And if you find that suddenly this person is able to speak, this is a stroke. This is a speech problem. There are times when people call up the ambulance service, sir, I can't, I think there's something. ठीक से बात करिए साहब. Why is it important? The last T is important because the duration that you have is just about 4.5 hours to give a medicine which can dissolve the clot. In United States, less than 20% of people reach within this window period. So you forget in India, not even 1% people reach in that window period. It's all because of lack of awareness about stroke symptoms. All diabetics, all hypertensives, all elderly people, all people with background of what is called as heart problem or coronary artery disease are at risk for stroke. They all must be educated into fast. Look at the facial droop, look at the arm swaying, look at the slurred speech, and if either of these things are there, there is a 60% chance of stroke. If all three are there, more than 76% chance of a stroke. And this tool was designed by an Indian for layperson sitting in America, right? So it's very important to identify this. You have just a window of 4.5 hours to give this medicine. And let me give you two different stories. This is a very renowned painter who lost the grip on his right hand. And he had another 20 years ahead of his life. And if that man doesn't get his grip back, he's dying a death every single day. If he reaches in time and gets back his grip, I think this is the best thing that you can give back to a person. So remember that time is essence, and if you think of stroke, let's get the people back quickly, all right? The other symptom which you should be worried about is people who are drowsy or sleepy, or people who are suddenly becoming violent. You see people suddenly starting abusing, or they are becoming violent. This can happen because of number of causes. It could be as simple as low sugar or high sugar, low blood pressure or high blood pressure, or to ingestion of some drugs or some inhalation. All of this can cause this. If you find anything of this, please get the person to the facility. If the person is drowsy or unconscious, and if he has pulse, I want all of you to remember a very simple thing. And that simple thing is called as turning the person on one side. Can we come here, Sudhakar? The worry in unconscious person is that the tongue tends to fall back, and this can close your windpipe. A simple act of turning the person at the right time can save somebody from dying. Lot of people who meet with head injuries don't die because of head injury. They die because nobody bothered to keep the airway open. Right? Please. So if you have, you're insured, no? Yeah. Okay. So Sudhakar is a paramedic who works with us. So if there is a person who becomes unresponsive, all you got to do is to turn the face on one side, and if you can turn the person also onto the other side, you can do that part. He's a very cooperative patient, right? That's the way you want to turn somebody on one side. This simple act can save lots of lives of people. But it's just out of ignorance that we don't do this part of the story. Turn the person off one side if the person is unconscious because of any goddamn reason. If you are in the middle of the street and if there is a person who is lying down on the road who is unconscious because of accidents, we are always told that we should not move a person. But if there is nothing that you can do and the person is unconscious, at least turn him onto one side. This might save him from choking to death or aspirating things into his windpipe and landing up into a serious problem. You saw the emergency. This is one of my best emergencies. Seizures, fits, convulsions. About 8 years ago, I was doing a very similar thing at the Numaish exhibition. And I actually was in the audience before we started the session, and I acted like a seizure patient. And I remember vividly the smell of the socks that were put onto my mouth. The smell of the onion which was picked up from the pav bhaji stall. The pain on the chest because somebody started jumping and pumping onto me. The splash of the buckets of water which were poured onto me. And then somebody actually tried to insert a key into my mouth. And then there was another fellow who was trying to open my fist and put whatever could come into it. There are some instruments that I have got for all of you. Where are those, man? That table? Okay. So here are some of our favorite instruments. Seizure management. Catch this. Onion. Have you seen this? Spoon. Have you seen this? चिमटा. ये तो बहुत ही बेहतरीन है. बीवियों ने अच्छा रास्ता निकाला, right? All of these things. Have you seen people using this? And then there is specialization also. You should not use iron key. You should use copper key. Right? All this is baseless. There is no evidence for all of this. They are good in kitchen, not to provide any kind of first aid. All you got to do in a patient of seizure is to make sure that he doesn't fall and prevent a secondary injury. And the second thing that you want to do is turn him onto one side to prevent aspiration. 90% of the seizures stop within the next 3 to 5 minutes. But very importantly, if this fit stops, don't let the person walk the street. You'll find in the next minute he throws another seizure and he's hit by another vehicle in front of him. So you want to make sure that a person who has had fits goes to a doctor and seeks medical attention as soon as possible. So remember, do's are turn on one side, prevent fall, make the person lie down and seek medical attention. Don'ts are no onion, shoes, chappals, no keys, no chimta, and no water. Right? For anybody, water has no role as first aid, and more so for somebody who is drowsy and who is unconscious, because what can happen, where can it go? It can go into windpipe. And then people don't actually have a problem with fits, they'll end up with a problem what is called aspiration pneumonitis and other things. Then burns is a very common emergency. Hands up those who have experienced some kind of burns. So very few of you work in the kitchen, right? Right. So burns is a very common emergency. Minor burns is not a problem, but the pain because of burns is something which you can never forget. And this is the only emergency where I tell people to use water. Water is your best friend in case of thermal burns. Not in electrical burns, but in case of thermal burns, you definitely want to pour water onto that area, because one, it keeps the skin moist. Secondly, it reduces the pain significantly. But do not use ice. Do not use cold water. That's not indicated. Because you suddenly got heat which is affected the tissue, and now you get ice put onto that tissue. There's a huge temperature difference that the tissues have to bear during that time, and that is more dangerous for the tissues. You sustain severe internal injuries because of that. So you want to avoid direct contact to tissues with ice or cold water. I don't know how many of you saw this visual. This is one of the most horrifying visuals that I have seen. This was a competition in one of the malls in the city organized by one of the radio channels, laddu eating competition. And there was an engineering student who was filmed live choking to death. I'm sure the editor must have patted on the back, was kya clipping liya aapne? This is shameful for a country like India. How can you film somebody who is dying in front of you and not even put down that camera and reach out and say, I just want to do a small goddamn thing for you. And what is that thing? This is the time to take out the animosity with the person. Please, aap Ajay sir, ye kanda mujhe de dijiye. All you got to do is go behind the person, keep one leg between two legs, make tight fist right here, and that's what you want to do. That good couple of blows could have saved this boy's life. That's called as Heimlich Maneuver. So let's understand what is a choking. Sudhakar, let's look at how does a person, who chokes commonly? Which age group? Children, elderly, and people who are drowsy, because your control on the cough reflex is not so good. So let's look at what is a choking sign. What's the universal choking sign? If you find that somebody is holding his neck tight, he can't speak, he can't cough, three elements, this is called as universal choking sign. So if you find somebody like this, you want to go across to the person and say, it's not a good habit to see somebody choking, go behind and stand. People question your tendencies, right? It's very important to tell the person that you are trained in first aid and you are there to help, right? All right, sir. My name is Dr. Joshi. I'm trained in first aid. Are you okay? You are not okay. Can you speak? Can you cough? Okay, sir, I think you are choking. Don't worry, I'm going to take care of you. Go behind the person. Put your leg in between. Look at the navel and the lower end of the breastbone. Make a good fist right here. Something should come out. If this doesn't come out after a couple of minutes because of lack of oxygen to the brain, the person might become unconscious. If he becomes unconscious, the reason I'm telling you to put the feet in between is, if he becomes unconscious, he might slump on the ground and you may fall with him. So if he becomes unconscious, you need to support him and put him down on the ground, right? That's the way you support the person. Thank you, Sudhakar. So remember, for choking in an adult, you want to do what is called as Heimlich Maneuver. If it's a young kid that you're dealing with, if you have a young kid who is choking, I'll tell you a horrible story from a family in Hyderabad. 2-year-old kid sitting next to the mother. Mother got a phone call. She was talking on the phone. Next she finds that the child is lying blue next to the telephone because there's a plate of almonds which was there. Cashews, sorry. This was just about 4 minutes away from the Hyderabad Apollo Hospital. So the family, as usual, put water and things onto the child, but they rushed. He was brought in about 8 minutes after he was identified. He was brought to us. We started to bag him, but the oxygen would not go in because the cashew had blocked the airway completely. So we actually had to break open his windpipe and put a tube from there and give him oxygen. We managed to get his heart back and everything, but unfortunately he was brain dead. And all the stories that I am sharing with you are not cooked up stories, they are real-time stories of horror. Right? All that was needed is to hold the child into the hand. If you have a chair to sit, well and good, sit, hold the child down, take your heel of the hand and just give good back slaps in between the scapula bone. This simple act could have prevented the death of the child. I can never forget that kid ever in my life. And these are stories that continue to happen. So let's understand universal choking signs: can't speak, can't cough, turning blue, good Heimlich Maneuver. If it's a child, you want to give good back slaps, call for help. Call for help immediately. All right? Yes, sir.
Child, what age group? What age group?
Yeah, so basically if it is less than 8 years and the child is small, you could do this part of the story where you can hold him down and give pat. But 8 years old kid in today's time, their sizes are different. Right? So if you can make him stand, you can be behind the child and you can do this. If it's a pregnant woman, then it can be challenging sometimes. You probably have to take a chair behind and do that part of the story. All right. Accidents. I don't really want to tell you horror stories, but I want to share a success story. 7 years ago in front of Chutneys, there's a young boy who was in MBA second year. His name was Shrikant. He was in an auto, he was on a two-wheeler sitting behind with his friend. That two-wheeler was hit by an auto. He fell down. There was a truck from behind which ran on his pelvis. It so happened that there was somebody behind him, and I have no qualms in taking the name of that person. His name was Ajit Bagga. A young guy who was behind in his car, he saw that thing happening and he called 1066 because he knew that number at that point in time. 108 was just about coming up. And he also made a simultaneous call to me because he happened to know me personally. He said, Mahesh, this is what has happened, what do I do? This was at about 10:30 in the morning, so there was peak traffic on that road during that time. I said, what has happened? He said, there's a lot of blood here and this boy is becoming unconscious. He's getting drowsy. I said, I will send the ambulance, but how's the traffic? He said, bad. I said, which vehicle do you have? He said, I have an Innova. Take help of people, put him, I'll get things ready and let's organize this part of the story and see what we can do. This boy was brought to us after he had lost about 3 liters of blood. The pelvis was crushed, everything here was crushed. He had a big gaping hole in his perineum, so much so that I actually had to put my hand inside the perineum and pack it with the help of gauze piece to control the bleeding till we took him to the operation theatre. He was a young guy, and I remember the moments that I spent with this guy. He looked into my eyes. I said, Doc, I don't want to die. And I remember we shifted this boy like this with hand inside his perineum. Just because he's a young kid, we want to give him the best shot. Although we were worried about how his life would be later on at that point in time. 2 years down the line, 6 surgeries. This boy did extremely well. Last week he is gone to New York on Wall Street. He's finished his MBA finance. This story is not to share the success of what we do. This story is to share a simple act which can change the paradigm of life and death. And that happened because of that bystander who stopped by and said, I want to at least not cross by this accident site. I want to call for help. This is the best first aid that you can do. Stop by and call for help. Wait till the help comes and you can do. You may not do anything else. I have heard stories where somebody came at 4 o'clock and crying incessantly and saying, Doctor Saab, सुबह मैंने accident देखा था, मुझे नहीं पता था ये मेरे father है. Today it is somebody else, tomorrow it could be you or your family members. You need to stop by, you need to call for help. In case of an accident, The simple things that you can do is stop by, call for help, stop external bleeding with the help of whatever clean that you can grab. Just stop that bleeding first quickly onto the person. If he's unconscious, turn onto one side. All right? Don't try and do anything heroic. If just you can remember that stop the external bleeding, and if he's unconscious, turn onto one side, you would have done the job. Be careful when you try to move the person with accidents. You can do more injuries. It's good for trained people to do that part of the story. Big nose for this. No water. Nothing to eat, because that one simple act could delay the life-saving surgery by 6 hours onto that patient. Because you know that the patient needs to be fasting for a general anesthesia to be given. So you want to prevent that from happening. So we've covered the major medical emergency. Quickly, I'm going to touch upon the minor medical emergency. The first and foremost of which is wounds and bleeding. All of you are aware of this, right? If there is a cut or bleed, what do you do? What do we do? You lift up, then raise, you press. After 1 minute, have you done this or not? Thoda work dijiye yaar. It takes at least 5 minutes for the clotting process to happen. Don't be in a hurry to see what has happened. There is no secret there, right? Wait. So 3 things: direct compression, elevation. All right. First, clean the part. Very important to clean it under flowing water. Secondly, direct compression, elevation. And if you find that bleeding is incessant, you can do proximal compression of the major arteries, which you can feel and block that. If it is bleeding from the hand, if it is bleeding from the toes, you can block the artery here. Okay? But don't be in a hurry to keep on checking whether it is clotted or not. And if there is bleeding which is continuous, don't remove the first dressing. Take another thing and put on it and wrap it up. All right? Okay, I'm going to skip this. Bleeding nose. Have you seen this? Epistaxis. Scary. Very scary. But what do you do in that case? What do we do commonly? Onion? Water? What should you do? You should make the person lie down, or you should make him sit up? Perfect. So you make him lie down, and after 5 minutes now he vomits blood. Now you're worried whether he's bleeding from nose or bleeding inside. So this is one emergency where you don't want the person to lie down. Because the moment he lies down, everything that is coming out is actually swallowing. And then he vomits that part of the story. So you want to make that person sit up at 45 degrees instead of trying to make him lie down flat. And I have got a toy. I'm sure all of you have got this. Alright? This is a simple thing that you can use for nasal compression. Alright? A towel clip with soft pads. Just pinch the nose rather than doing this. Right. Keep it for some time. Ice. Ice reduces the blood flow to the bleeding area. So you want to put ice and pinch the nose properly and it's never a life-threatening thing, but it's scary for people to see. Therefore, you've got to be aware that how do you deal with epistaxis. Broken tooth. Important thing to remember in today's time, tooth can be reimplanted. How do you preserve the tooth? So this is one time where you can use milk. Any milk is fine. Alright? Skimmed milk, 10% fat, whatever fat. It is fine. Just put it into milk and take it to a dentist. You can reimplant the tooth. Okay? Sprains. What is that picture, man? Biryani time. How many of you have had an ankle sprain? Wonderful. So if you sprain your leg, what happens? What's your next reaction? What do you do? Amma! That was the one. And then what do you do? Let me see if I can walk a little bit. Yeah, I can walk. Now your friend comes. What does he do? Now your friend comes and what does he do next to you? दिखा यार, दिखा क्या हो गया? अभी दुख रहा है क्या? अभी दुख रहा है? Yes? Have you seen that happening or not? Please stop doing all this. Remember rice. We are rice loving state and we are famous for rice. Rest, ice, compression and elevation. The first simple thing that you want to do is not to strain any soft tissue injury more. Remember that ankle injury can be very nagging. Any sprain or soft tissue injury can become a lifetime problem for you if you don't take care of it at the right time. So you want to rest, that means you want to fix that part rather than moving it. Ice is for ice fermentation so that you can reduce the swelling which comes onto that part. C is for compression. Use crepe bandage or any other bandage that you can to compress this so that you can reduce the swelling that is coming. And elevation, again to reduce the swelling. Because most of the times around the joint spaces, if the swelling happens, your movement gets affected. So remember, R is for I. So next time you eat biryani, you're going to remember, right? Great. Let's look at bony injuries and fractures. I'm going to give you some quick demonstration on various fractures and what simple things that you and me can do to splint somebody. Can we have a volunteer, Sudhakar? Let's look at hand fractures or clavicle fractures. How do we immobilize the person? If somebody has a fracture here, what can we do for this person? Is it painful? Any fracture is painful, right? And the best way to reduce the pain is to reduce the movement. So let's look at a simple trick on how do we immobilize the person. Alright, so assuming that Sudhakar has a fracture on his left arm. So what we are going to do is, this is called as a triangular bandage. You can make it out of a bed sheet. Hold it longitudinally where the tip of the triangle is pointing towards the affected side. Put it below the hand like this onto the opposite shoulder. There we go. And we created a sling for him. Right? That's a simple way of doing this. The other way that you can do is, if you want to really hold the thing tight, is to tie a knot onto this part. Let's tie a knot onto this so that it becomes like a pouch and you can hold it very simply. Let's do the same story again. Hand there, hold it. And there we go. Right. If you don't have this and you happen to be wearing a good shirt or a jacket like mine, there's another trick that we can do. Right. It's a small thing, but yes, it works at a time. A lot of us are fond of denim jackets. Right. You can just uproll this and tie the button up onto the other side. That's a simple way of immobilizing the affected arm. The same thing for legs. The simplest thing that you could do is tie the shoelaces together so that the movement of the limbs reduces. Okay? Very important for fractures, don't try and move and adjust those broken bones. If there is a piece which is hanging outside, don't try and push it inside, thinking that it will hit the right place and you won't need an orthopedic surgeon and then tomorrow you can start a clinic, bone setter. Right? This is a very, very scary thing in this country. You know that we are probably one of the countries where highest number of deaths happen because of rabies. Are you aware of this? How many people die of rabies? 50,000 people annually die of rabies. That's an official figure. I'm sure just a couple of states would come up with those numbers. Every single day, Prashasan Nagar, Jubilee Hills area, because most of the times there are big houses, old people, chowkidars and dogs. That's a sad story. And I deal with this every single day. And it's the neighbor's dog who has bitten somebody. Right? I'm going to tell you a shocking story of a young kid from Kurnool who was actually brought to us, referred for a psychiatric consultation. This was a kid who did academically very well from a very poor family, and he was taken on a scholarship with Narayana after 10th standard. And he was referred to us with abnormal behavior. He was brought in an ambulance, and the ambulance story was that the kid would not allow the mother to sit inside in the chamber. So mother had to sit in the front and come from Kurnool. When the child came to us, as soon as he was brought inside, this is what the child would do. You leave him alone, he would be quiet. You put the light on, this is what the child would do. Natural for anybody to think this is psychological. He's probably acting or doing up a scene. It's just after 15-20 minutes, we got the history on this child that he was bitten by a dog about a month back. They didn't do anything onto this, and that dog had actually bitten a couple of other people, and the dog is dead. What he had was actually, in real terms, called as phobia. You've heard of this, seen in movies, right? If they hear sound of water, they have hydrophobia, right? Their whole laryngeal muscles, these muscles go into spasm. It's one of the most scariest moments that I have ever witnessed as an emergency physician, to see a young child, you put on the light or the fan and his whole body would go into spasm, particularly the upper half of the body. I can tell you there is no worse death than rabies ever in life. It's one of the most horrible things for any human being to experience. Completely preventable if you do one simple thing. One simple thing, if you do it in the right manner, is to clean the wound within the first 15 minutes with nothing else but soap water. And this is a study done in Indian population. If you do good rinsing or scrubbing with the help of flowing water and soap within the first 15 minutes, you reduce the chance of rabies by 65%. But it's just sheer ignorance that we don't do this part of the story. The second thing that I want all of you is, we've become half doctors. If you have dog bite, Rabipur, you know this, right? Rabipur injection or Verorab injection or rabies vaccine. Thankfully, the golden days of 14 injections of the abdomen have gone, right? Please understand there are two different things. One is called as vaccine, one is called as immunoglobulin. Vaccine takes time for the body to build resistance in the body. You know that we all take vaccines at regular intervals, right? BCG, DPT and other things. So when you give a Rabipur or rabies vaccine, it takes a couple of weeks for that to start acting in the body. In case of a dog bite, when you go and seek attention, ask the doctor, does this need a rabies immunoglobulin? Because the vaccine is not going to protect you immediately. So think about this, clean it quickly, and think of vaccine and think of immunoglobulin. Don't allow anybody to suture this wound. If there is a doctor or a quack who wants to stitch up a dog bite wound, it's never indicated. It proliferates the germs inside. You want to leave it open as much as possible. One of the most famous and dearest animal of Bollywood. मैं तेरी दुश्मन दुश्मन तू मेरा, मैं नागिन तू सपेरा. And wonderful treatments, right? As soon as the hero is bitten by a snake, the first thing the heroine does is takes the dupatta out, right? And then the first kiss is there at the site of the bite. And then there is a dance sequence with Jharpuk Baba, Jinga Lala Hu, hurr, hurr, right? And then God is there, and then there are some taviz is there, some stone is there, right? All of this is humbug. You don't need this. Thankfully, in India, there are only 4 species of poisonous snakes. Most of them are non-poisonous snakes. Most of the people die out of fright, not because of the poisoning. If somebody is died immediately after snake bite, it is never because of the venom. It's because of the fear. It could have precipitated heart attack or a sudden cardiac death. Because the poison takes some time to brew inside in the body, it blocks certain things in the body, and that's how people get problem. So snake bite, remember, it's a life-threatening emergency if it's a poisonous snake bite, but most of the time it is not. So don't get scared. So in case of a snake bite, what are the important things that we want to do? First and foremost, remove the person from that site. Don't stand there under the woods looking at a fang mark. दिख नहीं रहा यार मेरे को. पीछे से आएंगे Cobra Baba, excuse me. You got to be careful, got to be smart. Move the person away from the site of the bite. And then look at few important things. Is it painful or not? And if somebody can identify the snake, try and take a picture, or look at if somebody who is trained in capturing the snake, do that. Lot of the times people do this. If there is a snake bite, they leave the person, run after the snake to kill him. That should not be the aim, right? So you want to first save the person. Cobra bite, viper bite, both Russell's and the other viper that we have got, saw-scale viper, and branded crate. These are 3 things. 4 poisonous snakes. Now cobra causes muscle paralysis. So what do people have? They start getting difficulty in breathing because their muscles become weak. You'll find that the eyelids start drooping. That is called as ptosis in medical terms, because the muscle loses the power. So the eyes tend to close. Don't think that he's sleeping. All right? So if you find this, this is a poisonous cobra bite. If you find that at the site of the bite there is intense pain and swelling, reddish discoloration, this is a viper bite that you're talking about. If you find that somebody starts bleeding immediately in few hours after a snake bite, then there is a possibility that this is a viper bite because it thins the blood. It reduces the clotting capability of the blood. So if you find that somebody has a snake bite, you don't take a call whether it is poisonous or not. Please take him to the nearest facility where somebody has anti-snake venom. Don't take him to XYZ's clinic who doesn't have any experience in handling snake bites. This is the mistake that most of the times people do. And if you're going to be working at an area where there are snakes and you're handling, it's very important to keep anti-snake venom as a part of the first aid kit that you handle. Just outside, outskirts of the city, Bayer has a large agricultural thing. And they run a very, very good program in terms of snake bite awareness and snake bite handling. So each of the people who work in the field there are trained in handling snake bites, and there is a cascade response in case of a snake bite. So, sorry?
Anti-venom and non-poisonous snake bite will not harm?
So it's like this. Now, earlier most of the times people would be tempted to give the anti-snake venom. But now recent guidelines tell you that unless there is a definite evidence of envenomation, that means like paralysis, abnormal lab reports, kidney functions are abnormal, you should not embark onto anti-snake venom. But if you give, it is not going to cause any harm. The only problem is, next time if the person needs an anti-snake venom, there is a slight risk of a anaphylactic reaction, allergic reaction happening because the body is sensitized to that foreign protein. Okay? That's the only small risk that you've got. No cuts, no sucking, and no tourniquets with dupatta. Okay? It's no more recommended because the moment you remove that tourniquet, what happens? Suddenly there is a surge of the toxin going into the blood and it is more harmful for the body. All you can do is just take a good crepe bandage, roll it up from distal to the proximal side, from away to the closer side, tight enough for a finger to go inside. Not very tight, because we've seen people who have been transported from districts with a tight tourniquet. It was a non-poisonous bite and the patient had to amputate his leg because the blood supply was stopped. So don't do that mistake. Yes, ma'am.
Which are the places where anti-venom is available?
Good question. So most of the good hospitals in the city, her question was which are the places where anti-snake venom is available. Most of the small time nursing homes would not give anti-snake venom. You need to go to a good government hospital, that's where you'll see it easily available, or to a good tertiary care hospital. Okay? Please ask when you shift the person, do you have the capability to handle snake bites? Right? All right. Yes, sir.
How does the doctor at the hospital know if the snake not identified, is it neurotoxic or hemotoxic, and which antivenom?
So good question, Shekhar. First and foremost, you want to observe the patient for some time. Then only you can come to a clinical conclusion. Secondly, in India, you don't have a specific antivenom. What we have is a polyvalent anti-snake venom, which acts against all of these. So there is no worry if it is Cobra versus Crate, you still give this same anti. You should be given as soon as possible, preferable in the first 6 hours. First 6 hours, if you can give that, then it will prevent the receptors from being bound onto the venom. Quickly, last 2 or 3 things, low blood sugars and high blood sugars. How many are diabetics here? Are we doing okay? Ajay, you're okay with time? Very okay. Okay. Are you guys okay? Yes. It's good to check, are you okay intermittently? Many of the time during this talks, people have cardiac arrest because they're so goddamn boring. All right. So, how many are diabetics who are sitting here? Don't worry, nobody is looking at you. Okay. 3. Again, this is a very blessed population. You know that every 8th person in this country, in this city, is a diabetic. We are the most sweetest people on earth. Do you know this? We are the diabetes capital of the world. Diabetes, you know, is imbalance between the sugar in the body and the mechanism which controls it. And that mechanism is called as insulin, which is secreted by one of the glands. If the insulin becomes low, your sugars go high. Just eating sweet does not cause diabetes. It's a myth. Please understand this. Eating sugar or sweet doesn't make you diabetic. It only increases the blood sugar levels, whatever are there in your body. So let's get that part of the right. The second thing is, in diabetes you can have two types of problems. One is very low sugar and very high sugar. How do you identify low sugars? Headache, giddiness, sweating, restlessness. And that's a person who is likely to have low blood sugars. Now please understand, lot of people die because of low blood sugars than high blood sugars. So low blood sugar is something that everybody who has diabetes or who has a relative who is a diabetic must be aware about. All right? Are you a diabetic? Okay. So how do you identify? I've told you that most of the times in today's time you must have a glucometer at home, because you never know when you will start with diabetes and somebody will have low blood sugars. If you think that the person has low blood sugars and he is conscious enough, then only give him biscuit, chocolate or a sugar syrup. But if he is drowsy and is unconscious, don't try and force that thing onto him, because it's not the low blood sugars that will kill him, it's the syrup that has gone into the lungs which will kill him. Right? Somebody had a question here? Right. So that's about low blood sugar. High blood sugar, restlessness, agitation, abnormal behavior, intense thirst, using the bathroom number of times, going urine in the night time, nocturia. You don't have to do immediately anything but to rush the person, because what can happen if the sugars go very high? You can develop what is called as diabetic coma. So you want to get that control, that can never be done at home. Shift the person to the hospital. Both emergencies, low blood sugars and high blood sugars, you got to shift the person to the hospital despite the person looking normal. Because right now the sugar has got okay, after a couple of hours again the sugar may drop down. Okay. Blood pressure related emergencies. How many of you have low blood pressure sitting here? You must have heard these stories in the school, you must have heard these stories as teachers, you must have heard these stories from young husbands and young wives. Right? Mujhe low BP ho gaya. It's not a problem. Low BP doesn't kill anybody, so don't worry about low BP. Lot of people have tendency to have low blood pressure, but it is worrisome when you start getting symptoms like blackout, unconsciousness, recurrent headache. What do you do in that case? Simple thing. The commonest cause of low blood pressure is underhydration. Hydrate yourself well. Improve a little bit of salt intake. High blood pressure can cause heart attack or it can cause paralysis or stroke. So you've got to be very careful about it. How does the person present? Severe headache, blurring of vision. Sometimes there can be slurred speech. You can have fits because of high blood pressure. If you let the pressure to be high, the blood vessels can rupture and you can develop stroke. So you could, great question. So how much is high depends on what is your baseline blood pressure. But what is the standard guideline recommended in today's time? The normal blood pressure is 120/80. You want to keep that. But there are people who are say 70 years of age. They may have a normal blood pressure of 170/90. The upper blood pressure, which is called a systolic blood pressure, tends to increase with age. See, in people who are elderly, 60 plus, 70 plus, you might find the blood pressure is a little on the higher side. So it's not the blood pressure reading, it's the symptoms which determine the treatment. So if you have headache, if you have blurring of vision, if you have what is called as loss of consciousness, if you have fits, then even if that blood pressure is just about 170/100, it needs to be treated. So you don't go by the reading, you go by what complaint the patient is having. Great question. Now, yes?
Throbbing with headache out here? Because if there's not a headache, but intense throbbing, isn't
Yeah.
that also a sign of hypertension?
Yeah, so basically throbbing is a subjective description. You know, a lot of people equate throbbing as headache. So one of the types of headache is a throbbing headache. All right? But classical of high blood pressure is when you get up from sleep in the morning with a heavy head. This is a classic sign of a new onset blood pressure or a blood pressure which is not controlled. Okay? So you get up with a headache in the morning, that's definitive. Yes, ma'am.
If you have for many years had a blood pressure say low of 90/60 and then it goes up to 120/80, would that be bad for the person, or Is it due to, sometimes due to age, it creeps up? Or?
Yeah, it is most likely because of the age that it would go up. But if it is causing symptoms of the things that I told you, any of this, then it needs evaluation. If you are asymptomatic, you don't need to worry about it. This is the important thing, and I put this slide just before I came, and it's about amputated parts. It's very important today's time to understand that your simple act of preserving the broken or the amputated part could give back the total functionality of that arm to the person. 15 years back, when I was working as a resident in Hinduja, there was a biochemistry technician who was in the bus at the Dadar circle with his hand outside. There's another brush which came and hit this. He had his arm cut from here. The arm fell down. You will not believe this story, but it's a real story. This guy had the courage to hold his hand like this, walk down from the bus, ask somebody to lift that hand, sit with him, take a taxi, come to Hinduja hospital with that arm, and that arm was implanted, and he's functional today. It's very important to think of amputation as an emergency where you can preserve the functionality of the arm. Every single day I have occupational injuries in factories where fingers are cut, crush injuries are there. You've seen crusher injuries, we don't see it so often, but during my residency I've seen crusher where hair gets entangled and the whole scalp comes out. Alright? Amputated parts must be preserved properly. So how do you do that? The first thing that you want to do is, if this is an amputated part, this is too big, right? If this is an amputated part, you first want to clean it. Now if there is an amputation, where do you want to focus the attention, here or somewhere else? This is the mistake that many people do. There is somebody who is bleeding there and people are trying to look for the broken part. First focus on the person, stop the bleeding there. And then ask somebody else to look for where the broken part is. However small it is, if you can get it, please get it to the hospital, a good facility where there is a vascular surgeon or a cosmetic or a plastic surgeon. And then as soon as you get this part, clean it with normal saline or normal flowing water as much as you can. Take a gauze piece, make it wet and wrap around it. Don't put this directly on ice. That's a mistake that a lot of people do. Don't do that part of the story. Wrap it, put it in a plastic bag. Now take another plastic bag which has ice and place this bag inside that. Remember, what am I saying? If there is an amputation injury, first stop the bleeding, then focus on to the amputated part. Clean it, wrap it in a wet gauze dressing, place it in a clean bag, and now this bag should go onto the ice. As I told you, direct contact with ice is not good for tissues. You want to avoid that. Alright, so do we have a couple of minutes, Ajay, or you want me to stop? Are you okay? This is important because I have been witness to a couple of... I am willing. As long as it is within the domains of first aid. So, the reason I put this slide is I have been witness to the Punjagutta Flyover collapse. I missed it just by about 3 minutes. I was coming back from Goa from, it was perhaps June month, if I remember it right. It was raining, it was a Sunday evening, and we were as family back from the airport, and there was a traffic jam, and I got out of the traffic and I tried to understand what is happening. Nobody had the clue because we were near lifestyle, the so-called lifestyle at that point in time. Could not understand. In the meantime, I got a call from the ambulance services saying that, sir, the bridge is collapsed and they've called for ambulances and we are rushing there. So I actually started walking from that site, and it took me about 15 minutes to reach around the site of the accident. As usual, there was utter chaos at that scene. And I remember I stood there for about 1.5 hours. It took about 1.5 hours to get a rope to barricade that area. Things are much better now. You know, you see these barricade ropes and things are there available with the disaster management teams. And I've witnessed bomb blasts. I've been part of responding to other disasters. What we do on disaster scene as a lay person, at that time in that Punjagutta flyover collapse, on that scene, whole of the media from Hyderabad was there. They blocked probably every single part of the story. Then came ambulances, they blocked one area of the axis. And then there was a convoy of politicians that came. They blocked the other part of the story. Thankfully, there were no casualties under that flyover at that point in time. There are very few cars which were trapped, not many people got killed. But there are times when there could be 50, 70 people. We've seen fires in buildings, we've seen bomb blasts. You saw a horrific scene at the Gokul Chat bomb blast. What can you do as a layperson there? That's called as, in life, it's all about triaging, prioritization. And that's a simple tool that I want to give all of you, because one simple act of segregating people and trying to identify who needs to go to the hospital first can significantly reduce the intervention time for those people. Unfortunately, in a scene in India, this is what happens. If there is a collapse, who are you? Which party do you belong to? Whom are you related to? How much money do you have in your pocket? That's what determines your priority. And that's the wrong way of prioritizing disaster victims. So let's learn a simple tool. This is called as simple triage and rapid treatment algorithm. This is used in a multi-casualty disaster. Let's assume that right now something happens here. And you want to call for ambulances. Ambulances are on the way. They are going to take about 10-15 minutes. Now you want to find out who is alive, who is dead, who is more serious out of this. How can we do this? Is there a simple way of doing it as a layperson, or you need doctor for that? Can we do this? You require doctors? What happened at the recent bomb blast? There were 2 simultaneous blasts. And if people had rushed into that scene, you know the New York fire tragedy, right? The Twin Tower collapse. You know why lives were lost in the second tower collapse? Because the overzealous firemen and the medics entered the second tower to evacuate people, and in the next moment that tower came down. Right? So you got to be careful. Make sure that the scene is safe. Don't rush into the area unless the fire and the police guys tell you that the scene is safe. And once you do that, the next thing that you want to do is walk into the scene, identify yourself. Hello, I am Dr. Joshi. I am going to take care of you. All of you who can walk up, please follow my hand onto this side and walk up in between those 2 windows. That's the first thing you want to tell, loud and clear to people. Those of you who can get up and walk, I want you to move right there in between these 2 windows. What you have done, and this is what happens in most of the incidents, majority of people have minor injuries. They are called as walking wounded. Just a simple thing of telling people, let's move on to one side, those who can walk. You have segregated what is called as priority 3 people in one simple way. But you got to be loud, clear, authoritative. Don't say, "Arey bhaiya, thoda sa jinko udhar ja sakte kya bhaiya?" Who's going to listen to you in a disaster situation, right? So you want to be authoritative, just like an army guy. I am Dr. Joshi. Those who can get up, please walk between these 2 windows and somebody will take care of you. That becomes the priority 3. Now I'm going to move upon and walk to the next person. Sir, are you okay? I find that the person is unresponsive. What does that mean? He's likely to be in cardiac arrest. If he is unresponsive, I'm going to just do a small thing of opening his airway by turning and head tilt. This is called as head tilt and chin lift. Just want to try and open his mouth and look for if he is breathing or not. If he is not breathing, am I going to begin CPR on him? Do we have time to do CPR when so many people are there? No. Remember, you want to do the maximum good for maximum people in disaster. You can't just focus on one person. First thing is walking wounded. Second thing, go across. Are you okay? Unresponsive, open the airway. He's not opening the airway. After opening the airway, he's not breathing. This man is dead. Don't waste your energy. Sorry, sir. You're okay. Okay? So, this becomes a P4 or dead category. You don't want to waste your energy. Don't waste your emotions. You want to move on to the next person. Sir, are you okay? Okay? And this man is, he's doing like this. Okay? Or there is another person who's unconscious. Are you okay, sweetheart? Okay? And then you open the airway. And as soon as you open the airway, this person starts. A person who is unconscious but on opening the airway starts breathing is the topmost priority. You can save this person. This is called as a P1 person. Okay? So unresponsive, open the airway, not breathing, dead. Unresponsive, opening the airway, he starts breathing, P1. Let's call the ambulance. As soon as the ambulance comes, Ajay, tell this guy, this is going to be the first priority patient. You're going to tag this person in red color. That's the universal color that you code for. If you don't have anything, follow the army thing, take a red pen and mark on the forehead. Okay? Put a star or whatever with the red pen, and that can be identified at a distance, because when the ambulance guys come from a distance, they should look at how many reds, how many green, how many black, how many yellow, and they can call for more backup vehicles. All right? Universal, yes, universal color code for disaster triaging. All right? So priority 4, then we come up to priority 1. Now if the person is breathing, you want to look at, is he breathing normally or abnormally? That means is this very fast or both these people will fit into priority 1 category, right? But if you find that the person's respiratory rate is fine, just like what you and me are breathing, then you go and check the pulse onto this person and find out how's the pulse. If the pulse is very rapid, that means his breathing is okay, but the blood is not flowing well. This man is also an urgent category. Okay? But if you find that the breathing is okay, the pulse is also okay, this becomes priority 2 for you. Do I make this clear? So let's look at, I am going to quickly run through a couple of situations. Okay, I walk across, are you okay? The person is unresponsive. I open the airway and he is not breathing. What's the category of this person? All of you agree? Very few times so many human beings agree on something they were taught 1 minute ago. And that's the power of this tool. I'm going to move on to the next person. This is a person who is screaming and shouting, "Arey doctor sahab, kuch kariye, kuch kariye. Arey doctor sahab, kuch karte kyun nahi? Kuch karte." What is this category? What's his category? People who scream are never an emergency, please understand. Okay? Just like what I am screaming right now, right? So people who scream are much safer than people who are quiet from an emergency perspective. Remember this. All the time, in any emergency. And this is a dictum. Please understand, that's what happens in emergency room. There is a guy who's got a fracture and he goes, "Arey doctor sahab, kuch kariye." And there's another guy who's in one corner. This guy is choking, but he is not seeking attention. And people who have minor things always ask for major attention in life. Okay, so let's move back to this person. What is this category, P1 or P3? P3. Let's move on to the next person. And this person, are you okay? Okay. So I go across to this person. I open he's unresponsive. I open his airway. As soon as I open, he starts doing this. What's the category of this person? P1. Do you agree? Yes. Fantastic. Why don't you give a big round of applause to yourself? Who's teaching you all these things, man? Huh? All right, let's move on to the next person. Okay, this is a person who is conscious, but he's breathing rapidly. His respiratory rate is 40. What is going to be his category? Priority?
Respiratory rate or the pulse?
Respiratory rate is 40 per minute. He's breathing very rapidly. Now I check the pulse, it is about 140. What is his priority? Sorry? Pulse is very fast, breathing is very fast. That means oxygen is less, blood is less. All right? So this becomes P1. All right? They don't want you to be P1, sir. Okay? Sue them in the court of law. Okay? Last patient. We move on to the next person, and he happens to be a person who is sitting there, dazed. He's shocked with what is happening. He's breathing normally. You check his pulse. His pulse is about 100 per minute, and he's crying. What is his priority? But he happens to be the chief minister's son. What is his priority? Can you focus the camera on these 3 people? I want this recording tomorrow. Okay. All right. So, what I demonstrated to you is the power of a simple screening tool that can be done by a common man in the street. You don't need any training at all. Just a couple of times, and you could save so much of time. Now imagine before the ambulance comes, you have segregated P3 guys, and you take some good bystander and say, "Boss, गाड़ी निकालो, इनको गाड़ी में लेके जाओ, ambulance waste करने का time नहीं इनके लिए." Right? That's how you efficiently use the services.
Where's the
So P4 is dead. Great.
P1 and a P3 and P4.
No, I said P2. P2 are people who have, upon opening the airway, breathing, you find that their respiratory rate and pulse rate are reasonably okay. That these are the P2 patients. Okay. So P4, again, I'm glad that you took this point out. You know how many mortuary beds are there in this city? Take a guess. How many mortuary beds are there in this city? And if Manthan can take up this issue for a cause, I think it's a great work that we can do together. The reason I am telling this to you is I sit on the Hyderabad International Disaster Response Committee as the medical response coordinator. We do drills every year. And if you look at a A380 fire at any point in time or a big aircraft crash, how many people would be involved at one time? So about 300 people, and if it is an aircraft crash, most of the times people are dead, right? You don't see many P3s in those. You see most of the times people are, except something like Japan where it breaks into two and people are still alive. You saw those visuals, right? Dramatic, alright? So most of the times people are dead. You remember the visuals of Mangalore aircraft crash? You know how many days it took to retrieve bodies from those hills? They were decaying, and in Indian weather, the bodies decay faster. There is no mechanism for us to handle P4 cases. There are just about 150 beds, mortuary beds in this city. That's it, and most of the times they are full. You have to pay money to get a mortuary bed also. Most of the times these are in government hospitals. Very few hospitals have just couple of mortuary beds. Osmania and Gandhi is where you have mortuaries, and they are most of the time full. There is no mechanism to handle dead people in case of a major incident. This despite the fact that this city has witnessed couple of major incidents. I think this is something that we can take up. There are a lot of intellectual people here who represent different organizations, and if we can create something like this as a part of the disaster response thing, it would be something good, because remember, it's always good to handle the people alive, but what media focuses on is the dead bodies, and that's where your image, your sensitivity comes into play. You may have a fantastic response in the hospital, but all the visuals are coming about dead bodies who nobody is taking care of, and it's our responsibility to hand the dead properly to the family when they come. That's the least that we can do. So these are some of the things that you use to tag. These are cards that can be placed onto person, and somebody who is P1 by the time he reaches hospital can become P2, P3, P4 depending upon what care is given. So triage is not a one time thing, it is a dynamic thing. You have to keep on checking again and again. So this is what we talked about in the last whatever minutes that we spent. We looked at major emergencies: heart attack, stroke, poisoning, cardiac arrest, burns, choking, seizures. And then minor emergencies like bleeding, soft tissue injuries, sprains, fractures, low BP, high BP, low sugar, high sugar, dog bite, snake bite. And we also talked about multiple casualty incidents where you looked at the triaging skills. I want to sign off by saying a few important things. This is very basic. It is not advanced medical science, but done in the right manner at the right time, this can make world of difference. And there is something called as chain of survival, which begins right from the incident site. Hospitals come in much later, but if we can act in the right time, you might be able to save somebody's life. And who is that person likely to be? Somebody known or unknown? So I want to share a story of a young doctor about 6 years ago. That's my last story, I promise to all of you. He was at home and his father was sitting next to him, and his father went inside the room. He was supposed to go to E-Seva to pay off some bills, and his father said, "I don't feel well today, why don't you go tomorrow?" This was an unusual request because his father never made anything like this as a request to him. So he talked to his wife, "Yeah, I think I must go to E-Seva and finish this," because he's scared of his wife. Right? And she said, "No, if dad is saying like this, why don't you wait?" Next I hear this guy heard a scream from the wife of this gentleman. She said, "Something has happened." This guy rushes into the room and he finds that this gentleman is lying on the bed and he's uprolled his eyes and he's had a fit, goes, he checks responsiveness, he's unresponsive, he's not breathing. He starts CPR, he calls for the ambulance. It so happens that the ambulance responds in time with a very good paramedic. It so happened that paramedic was trained by this doctor. He carried the right equipment, a very similar AED. He was shocked at home using this machine. Blood samples were drawn, transferred to the hospital. In about 17 minutes, he reached the hospital. Shocked about 13 times, CPR given for 45 minutes. Landed upon dialysis because his potassium and other values were abnormal. Unconscious for 4 days. Came back to normalcy after 5 days. Lived a normal life 5 years thereafter. There is no bigger gift than this that you can give to your near and dear ones. And this is the story of my father. The reason I share this story with all of you, if of all the things that I have done in medicine, if there is something which has given me the best thing in life, is training for first response in CPR. There is no procedure that I taught to my students, there is no knowledge that I gave to my students would have translated into saving the life of my own father. And I can bet on to you, you can try anything in the world, but giving back a father to a son, giving back a husband to a wife, and giving back a grandfather to a grandchildren is the biggest thing that you can give. And you have that opportunity to do it if you remember these things and practice on mannequins rather than on people. I thank Manthan for this opportunity, and if there are any questions, happy to take it if time permits. Thank you.